Andy, how's it going, man?
Good, how are you?
Good. Welcome to Boston.
Thank you. I finally got my excuse to explore Boston. So
Yeah. How was the trip here?
it was good. It
Yeah.
was longer than expected, and it's way hotter than I
It
expected
is
in here.
so warm right now. Yeah, for sure. So you ready to do this thing?
Absolutely. Are you ready for your send me three questions?
I guess we'll find out. Let's do it.
Oh, I know it's the end of a busy-ish day. So let's get started. What is your name?
Tommy Martin.
And what is your specialty?
So I do combined internal medicine and pediatrics.
And how many years have you been practicing?
Not counting residency, I am about to have my 1 year anniversary.
Awesome. So where did you go to undergrad?
So I did undergrad at Kansas Wesleyan University in Salina, Kansas.
And medical school and residency?
So medical school at St. George's University in Grenada, and then residency at the University of Arkansas for Medical Sciences.
And did you take any gap years before going to med school?
Nope, I went straight through as fast as I could.
Smart. So, and I guess it hasn't been too long ago. So, what would you say was your favorite part of medical school?
My favorite part of medical school. So meeting my wife would be by far the most incredible part. I know that hasn't doesn't have to do with medicine, but meeting her was by far my favorite part.
I think that's one of the best medicines you can have.
Yeah.
So, now, what specialty did you think you were going to go into on your first day of med school?
Surgery. I was dead set.
And what changed your mind about that specialty?
A little bit of a story, so hold on tight. So I started medical school. My wife and I both actually wanted to do surgery, and we were dead set on it. Surgery was actually my first rotation, and it was intense. We had my first week, I documented it was 126 hours. So it was a lot of work, and I loved it. I loved every part of it. We were in a community-based hospital, and I got to work a lot, and so I truly loved it. One morning, it was 4 in the morning, there was this patient that we were rounding on, and they could have had cancer. And we didn't know for sure, but as the general surgery team, we had to do a biopsy. So we went in at 4 in the morning, woke them up, said, we think, or I did not say this, the chief resident at the time had said, we believe that you may have cancer and we need to do a biopsy, but we're going to have to get going. We have to get to the OR. The patient obviously was very distraught, absolutely crushed. And I could tell that this news really upset them. But we had to get to the OR. We were on a very tight schedule, so the chief resident told us that we had to get going. I had noticed that this patient had a cross hanging from their neck, and so I asked the chief resident if it would be okay if I stuck around and hung out with the patient. And the chief resident said, you do what you want to do, but we have to get to the OR on time. So I stuck around and just talked with the patient, heard them out, let them express their feelings, and left, and never thought anything of it again. Finished my surgery rotation, loved it. It was an incredible time. Got to do a lot of. I amputated a leg. It was just so much fun. But then on my internal medicine rotation, I get a call from an oncologist. I didn't know that, or a message from an oncologist. Didn't know this oncologist really. They asked me if I could come to their office, and I said, "Of course I can." I don't know why you'd want me to go to your office, but I could go there. And when I get there, they say, "I want you to go see this patient in this room." I was like, "Oh, this is really weird." Okay, so I went into the room. And as soon as I opened the door, it was the patient, and they said, it's you, it's the angel that God had sent me. And they told me that me praying with them that day and talking to them made all the difference, and that they were thankful that they got to see me again. And so from that day forward, I knew that I wanted to do something in medicine, that the lifestyle wouldn't restrict how much time I could spend with my patients. And not that you have to do that as a surgeon, but the lifestyle of a surgeon can make that quite a bit harder to have as much time as you want with the patients.
I have very similar experiences from my internal medicine rotation, so I definitely know how you feel.
Yeah.
So, were there any specialties you immediately said, absolutely not for me?
I don't think so. I would say I started off with an open mind. I pretty quickly ruled out psychiatry and OBGYN, but I still loved those rotations. I just knew that they weren't for me.
Gotcha. Well, speaking of what is for you, what first made you fall in love with specifically Med-Peds? Because it is an interesting combination.
Yeah, so the experience that I mentioned about why I did not go into surgery led me to internal medicine, and loved my internal medicine rotation. I thought that that would be a great specialty to have so much time with the patients. Well, then on my pediatric rotation, there's a couple different instances. One is I had a child on my hematology oncology rotation. That it's a little embarrassing story too, but this child was going through chemotherapy and had lost all of her hair, but she was still so joyous. And one day she said, "Dr. Tommy, I bet you don't know how to dance," which I don't, but I could not let her know that. So I was like, "Come on, I know how to dance." And she's like, "Oh yeah, well, let's have a dance competition." Literally within 1 second, yelled and asked everyone to come watch this dance competition. So all the attendings that I didn't know very well, all the nurses that I didn't know very well were coming to watch this dance competition between me and this patient. And obviously I don't know how to dance. And so crazy embarrassing, but to see a child going through something so hard and to still be so joyous and to have so much hope was so incredible. And so when I had that experience on top of these incredible patient encounters that I've had with adults, I knew that I wanted to be able to treat and serve all age populations. And then so with that, you could do family medicine, you could do internal medicine. But for some other reasons, I chose to do Med-Peds because I didn't know if I'd want to specialize in the future, doing hematology, oncology, or other things. And ultimately, one other part of it was that Med-Peds is a highly sought after specialty for overseas mission work. And so knowing that that is a passion of mine and that I might need to treat a huge age range, Med-Peds was perfect.
Yeah, I've heard Med-Peds and pediatric emergency medicine and emergency medicine doctors are the most sought after for overseas work.
Surgery is another big one. Yeah.
So for those interested, you said it was very well sought after. How long does your training take after med school?
So 4 years. So Med-Peds, you do a 4-year residency program, essentially.
Right. Did you consider getting any other degrees, like an MBA, MPH, anything like that?
Always. I'm still thinking about it. I want I want an MBA. I want an MPH. I've thought about doing all of those, but throughout school, as I mentioned earlier, I just wanted to become a doctor as soon as possible. So I went straight through, didn't waste any time, but I still do want to get some of those.
Not too late.
Yeah.
What would you say is the most unique part of your specialty?
Wow, the most unique part of my specialty. I would say that all within the same week, you can have an experience where you get to become best friends and hear a lifelong journey of a 99-year-old male and hear them tell you all of their incredible life lessons and just have a very deep personal relationship. And within 8 hours have a birthday party that's Mickey Mouse themed, where there's a giant cake and balloons everywhere and everyone is having a huge birthday party in the hospital. The fact that you could do all of that in the same day and treat such a wide range of patients, I think is unmatched.
All right, so now we're getting to the part of all my interviews where I let the physician sell their specialty like a car salesman.
Goodness.
Why should someone choose your specialty?
I think I've already done a really good job at it, but I would say that you should choose Med-Peds because it makes you the most well-rounded physician and with a huge depth of knowledge in all of internal medicine, so all of adult medicine and pediatric medicine. So you have a very well-rounded knowledge base to serve the entire population. Not only that, but you are going to have two very differing types of relationships that you get to have on an everyday basis, and that's like a very mature and deep relationships with adults who can teach you so many incredible lifelong lessons, and you're going to create a best friend for a lifetime. And then on the other side of that, you're also going to form or get to experience fun and joyful and exciting relationships with these children who, although they're going through so much medical treatments and hardships, they have so much joy and so much hope. So you get a huge range of emotional gratitude on top of that medical experience. And not only that, if you want to specialize, so if you want to do Med-Peds hematology oncology, if you want to do Med-Peds cardiology, allergy, and immunology, doing Med-Peds still allows you to specialize as well. So for me, it was perfect. And I think for a lot of people, it is an incredible specialty that's not very well known.
So play devil's advocate, why should someone not choose your specialty?
So you should not choose Med-Peds if you want to do surgical procedures, because doing Med-Peds, you do not get to do surgery. You do procedures such as central venous lines and things of that nature, lumbar punctures, you do a ton of those, paracentesis, but you do not get to perform surgery. So if you want to do that, it is not for you. Another one is if you want OBGYN experience, so such as family medicine, they get OBGYN experience and can do a lot of that. Internal medicine, it's a lot of programs do not have that experience, which you can get it, just not quite as much of. Also, I think those would be the main things. Yeah, I think that's about all. Yeah.
Alrighty. So I always include this question of, are there any stereotypes of your specialty, particularly for Med-Peds? The one that comes to mind is it's the people that just couldn't decide between internal medicine and pediatrics and said, screw it, we'll do both. Is that true?
That's 1,000. Well, that is true that's a stereotype. I don't know if it's truly the case. For me, it's definitely not. It's that I truly wanted to do both, and I wanted to serve both populations, and that's why I currently still do that.
Yeah. All right. Fun question. With any stage of medical training, from third-year med student to even a second-year resident, there is this concept of on-the-spot testing of random medical knowledge called pimping. So what is the craziest question you've ever been asked by an attending?
Really quickly, Andy, do you know what pimping means? Or do you know what the acronym is?
It's an acronym?
I don't know if I'm making this up on the spot or not, but I think it's an acronym.
No. What does it mean?
Isn't it funny that I'm pimping you right now? Afterwards,
yes. I'm a little scared.
So, put in my place.
I learned something very new today.
Again, I don't know if I made that up or if that's real. I think it might have been there's some surgery book that you read in third year on surgery. I think it was in that book, and I still remember it to this day, that's what pimping stands for.
Whoa. Okay. I think that might be the craziest question I've ever been pimped on. But that question wasn't for me.
Yeah. So the craziest question that I've ever been pimped on. Oh my goodness. I wish I could remember the exact question, but there's no way I'm going to remember it because I didn't know it then. I still don't know it now. It was with the surgeon who literally asked the most obscure questions during a procedure. And it was some anatomy question about some probably artery or vein that was the tiniest one in the whole entire body that no one in the world knows except for him. But it was something like that. I don't remember exactly.
It's always just the anatomy ones.
Yeah.
Alrighty. So I know we caught you on a day after clinic, but what does an average day look like for you, especially knowing that you're doing both medicine and pediatrics?
Yeah, so I was actually in the hospital I do hospital medicine. And so my average day really depends on what type of medicine I'm doing. So I'm just going to show you a day in my life with internal medicine or pediatrics and kind of give you a big overview. So the way it works is I do internal medicine and pediatrics, but not at the same time on each day. So today I worked in the pediatric hospital as a hospitalist. And so my day schedule today was waking up at 4 a.m. I got in my car by about 4:20 and drove to Boston, which is a pretty long commute for me. When I got up here, I worked out. I ran 9 miles before work today, and then I lifted, and then I got to the hospital by around 7:15, or actually I was a little late. I got here at 7:35. I was supposed to be there at 7:30, and then we get sign out from the day attending. From there, we do case management rounds and things of that nature. I round with the residents from 8, and I try to be done by 10:30. And then from 10:30 to 12, do documentation, looking over labs, things of that nature. The residents are calling the consultants. After they have noon conference from 12 to 1, we usually have some sort of conference. And then 1 to 4, we do any procedures that we have, talking to consultants, and then doing teaching in the afternoon. And then I usually get to do sign out at 4 o'clock and leave the hospital by 4:30. Then I commute home, which is about a 2-hour commute home, and I get home around 6:30 on most days. And then from 6:30 till bedtime, I'm with my family. That's at the pediatric hospital. I do 50% pediatrics and then 50% internal medicine. My internal medicine day, I don't always work with residents, but it'd be similar or a little different.
So, on average, how many patients do you think you see in a day?
It depends on adult medicine or pediatric patients. So in the pediatric hospital that I work at as a hospitalist, our unit is a step-down unit from the ICU, so they are more complex and more intense patients. But so we see there's 12 on each team, so I'd have 12 patients on that service. The adult hospital, it ranges anywhere from 12 at the absolute low end that hardly ever happens, upwards to 16-ish. On average, it'd be 14.
Okay. So it sounds like you do mostly inpatient. Any outpatient?
No, zero outpatient.
Yeah. So what's the most amount of patients you've seen in a day?
Oh my god. I'm assuming that you mean as an attending.
Yes.
Yes. Okay. So as an attending, 17.
Okay. So what flexibility do you have being double boarded?
You have tons of flexibility. I've talked about this some, but being a double board certified in internal medicine and pediatrics, you have the opportunity to work as a combined Med-Peds hospitalist. So I could practice internal medicine and pediatrics as a hospitalist. And if you don't know what that is, it pretty much just means a doctor who only works in the hospital for patients who are sick enough to be in the hospital. Okay. You also have the flexibility to do outpatient medicine. So you can open up your own clinic and have a Med-Peds clinic where you see only outpatients. You also have the flexibility to do both. You have the flexibility to specialize, to do cardiology, pretty much any specialty that you'd want to do. You could do a combined Med-Peds specialty, or you have the flexibility to just practice one or the other.
So, you've talked about this crazy age range that you get to take care of as a Med-Peds doc. What is the youngest patient you've ever taken care of?
Birth. Yeah, so I guess a couple hours, 20 something hours.
What's the oldest?
102.
Ooh.
So far. Yeah. And that's since being an attending. In residency, I had someone that was 106, I think.
Gotcha. And again, like you mentioned, this is, at least to the general public, not a very well-known specialty. Right. I think in medical school, we all know how popular it is. So what is one thing people misunderstand about the field of Med-Peds?
I would say that this would be for medical students and residents, my answer, but it's that it is an extremely competitive specialty. It is competitive. There's not a ton of spots throughout all the programs, but at the same time, depending on the year, the spots aren't always filled. And so if you are someone that wanted internal medicine or pediatrics and there are unfilled spots in the match, then it would be something to look into. Now, it is filled a lot of times, but I know a couple years back, there was a couple of times throughout, I think the last 5 years or so, that there were some open spots. So I'd say that it's not crazy competitive and you don't have to have the highest board scores or something like that to go into. So I'd say that's one. Another thing that people don't understand is that you can specialize. A lot of people think that if you go into it, you're either going to be a hospitalist or you're going to do outpatient medicine, but you can still specialize and double specialize in internal medicine and pediatrics.
Yeah. What would you say is the toughest part of your job?
Time away from my family. It's crazy hard, especially with my commute and stuff. I'd say that time away is hard.
What's the most rewarding part of your job?
I say relationships with the patients and your colleagues. Whenever you are able to make an impact on a patient from a medical standpoint is incredible. From a physical or emotional standpoint, mental standpoint, making that difference in their life makes everything worth it.
Yeah. Some more numerical questions. How many hours do you work in an average week?
Depends on the week. If I'm off, I work 0. So as a hospitalist, we do 7 days on and 7 days off. Being Med-Peds, my schedule is a little bit different. So a week on service would be closer to 80 to 90 hours, depending if I'm with residents or not with residents. So I'd say average 70 to 80 when I'm on service.
Okay. What time do you normally wake up? And I know this is, for you in particular, this is going to be unique.
Yeah. This week, I woke up at 3:50 every day.
That's not normal.
I can show you on my watch.
Well, there's a reason for that.
Yeah.
So, what time do you normally leave the hospital?
Depending on the hospital that I'm working at, it could be anywhere from 4 o'clock to 7 o'clock.
How many hours of sleep are you typically working on?
So, I will say on average, 6 hours and 45 minutes.
That's so precise. How many hours of sleep are you working on right now?
6 hours. Oh, today would be 6 hours and 15 minutes.
Again, extremely precise.
My Garmin watch tells me everything.
Okay. Do you have to take call?
do I have to take? So not necessarily call. So call is a hard concept in the hospital medicine. We have a late call where you have to stay later than other days, but it's not like you're there all night or anything. So there are days that I have to stay till 7, and we call that on call, but it's not really on call. Pediatric side, I don't take any call. There are also backup calls where you could get called in. It's like sick call. So if someone calls in sick, you have to go in. If the census is crazy high, you could get called in, and we are on call for those. You don't have to be on the hospital. You just have to be available to go into the hospital.
Okay. You a night or day person?
Day, but some people would call 3 in the morning night, but mainly I would say I'm a day person.
Gotcha. So, really important question. How long does it take you to chart at the end of your day? I think that's something that a lot of people don't consider.
Yeah, another thing is, so it's interesting, right? So as a hospitalist, you're charting throughout the day. And so in outpatient medicine, you see all your patients, try to do some documentation, and then a lot of your notes are saved for the end of the day. It's not really like that as a hospitalist. And so at the end of the day, my documentation should be done near the end of the day. When I'm on resident services, it depends when they get their notes done. And then I might have to do about 20 minutes or 30 minutes of attestations of notes at the end of the day.
Okay. So who are you most thankful for on your care team?
Depends. If I'm on a resident service, I would say the residents. I would say the residents and the nurses for different reasons. I'd say when I'm not on a resident service, always the nurses, although I'm so thankful for every single person on the care team, but there's specific reason why the nurses. On the resident service, I'd say residents and nurses because they're literally the eyes, the ears, the hands and feet of the patients, like to us. And so they do all the work. And I am so appreciative of them. And while doing all their work, they're learning, so they're just constantly working, not only their brain, but like everything. And so I'm so thankful for them. When I'm not on a resident service, the nurses, again, for the reasons I mentioned, nurses are literally the biggest asset to a physician. They are constantly with the patient. I trust a nurse's assessment of my patient more than just about anything because they're always at the bedside with them. They hear everything. They see everything. They get to know the patient on a much deeper level than I ever could. And so I am so thankful for my nurses.
And what has been the most impactful patient encounter you've had?
Yeah. There's been a multitude, and I've already mentioned some, so I'm not going to mention any of those, but I'm going to mention one that I had my last year of residency. And so I'm going to try not to cry, but I'm a big baby, so it might happen. But I was a senior resident and got an admission right before the end of my shift. And that's, as a resident, that's always the worst, right? Like I want to go home. I want to see my son. I want to see my wife. And like 15 minutes before the end of my shift, I get a call about an admission. So I go and I'm trying to rush through, get the admission done so I can get home to my family. And this patient was in for failure to thrive, not being able to take in enough oral food, had a terrible malignancy that was going to end their life. And I was trying to get the admission done so I could go home and see my family. When I talked to the patient, they just said, "Get your stuff done. I know you're wanting to get out of here," and something like that. And I mean, they weren't wrong, right? Like I did want to get out of there, but I think that they had just had that mindset that people are just going to get them into the hospital and do what they need to do. And I was asking them questions, doing the admission, placing the orders. And I just asked the patient before I walked out of the room, and I said, "We both know this cancer is not curable. And I'm just curious, if you could have anything in the world to eat, like anything in the world, what would it be?" And the patient had said, "Carrots with lemons." I'm like, what? Who in the world would want carrots with lemons? Like, that's got to be disgusting. I don't even know who would eat that. But I did say that. I was like, interesting. That's an interesting choice. And it's like, well, have a great night, and I'll see you in the morning. Well, I went home, looked up recipes for carrots and lemons, and made some carrots and lemons. Didn't understand why anyone would want that. I didn't even know if I made it right. But the next day I walked in and I brought in some carrots with lemons. And when I walked through the door, this patient, as sick as they were, immediately could smell the carrots and lemons. And they said, oh my gosh, you made carrots with lemons. That's what my mom used to make for me as a kid when I was sick. And they were just so thankful. so thankful. And like I started crying, they started crying, and it was just an incredible moment. It made me realize that every single patient needs to be treated with everything we have, our full heart, not wanting to leave the hospital. And yes, I have family at home that I want to get home to, but in that moment, I could spend the time to spend with them, and that it is often the small moments at the bedside that we spend and get to know a patient where we can make the biggest impact. And that was probably one of the most meaningful patient encounters. Yeah.
It's an incredible story. And so, what is the most common medical advice you give to your patients?
Oh, that I give to my patients. Oh. As a hospitalist, this is tough. I would say, yeah, I would say it's honestly like to, it's hard. I deal with so many different disease pathologies across so many different ages. There's like 1,000 different things. I would say the thing that I say most commonly would to do things that you love, whether it's my patients or not, because that's going to give you joy and happiness even if you're going through ailments. And so even though that's not medical advice, I think it is technically medical advice if it helps them to live a happy life, and I think that'll improve all areas. But that usually comes up in conversations sometimes during their hospitalization.
Oh, all right. We've talked a lot about your life inside the hospital. What about your life when you clock out?
Oh,
and
goodness.
We'll kind of dive into your crazy 3 a.m. Wake-up times. What's your favorite thing to do when you're not working?
I would say over the last 3 years being with my son and wife.
And you said you have a significant other. How many kids?
We have one.
And does your family ever ask you for random medical advice?
Oh, yeah. All the time.
What's the weirdest question a family or friend has ever asked you?
Ooh. The weirdest thing... I don't think there'd be too many weird ones, really. I mean, I've gotten a lot of questions about, like, lumps and bumps on genital areas, and if it could be normal and not normal, if it should be worrisome for cancer. I don't know if this would count as weird or not weird, but just interesting. But a lot of people open up about sexual questions to, I think, family members who are physicians. So, like performance and things of that nature and guidance on that.
Any pets?
No, but we're going to get a dog. Don't tell my wife that, but we are getting a dog. My son loves dogs. My son absolutely loves dogs. And you guys haven't got to see him yet, but he's the cutest thing in the world.
Let's see if I can focus. Yeah, perfect. Yeah. Oh my gosh. So, any favorite animal not a dog or cat?
Not a dog or a cat. I would say a kangaroo.
Nice choice.
Thanks.
If you could have dinner with anyone in history, who would it be?
In history, my grandma.
And what would you guys be eating?
Her meal that she'd cook is every night. She'd cook. People are gonna give us so much hate about how unhealthy this is, but she'd cook fried potatoes, green beans cooked with bacon grease, fried chicken tenders, a steak, and macaroni and cheese. And she'd cook that every single night.
Sounds amazing.
Yeah.
Oh, what is your favorite dish to eat?
So I love all food, but when people ask this question, I always go with my post-race food. I mean, people are going to think I'm the most unhealthy doctor in the world. I only eat this post-race, but it would be the largest nachos I could find, the most amount of chicken wings on the menu, and then the biggest burger they have with sweet potato fries. And then for dessert, I like a pizookie if they have it. And so that's like a cookie that's cooked on a steel iron skillet with ice cream on top.
Oh, God, now I'm hungry.
Yeah.
Oh, speaking of hungry, any favorite restaurants around here?
In Boston, I really like Cava. That's a Mediterranean restaurant. It's like fast food Mediterranean, I think. I haven't really got around much, but that'd be one of them.
Coffee, tea, or soda?
Ooh, that's so hard. That's so hard. I think I'm gonna go with soda, like diet soda, Diet Mountain Dew.
Okay.
Yeah. I drink a Coke.
How much water should you be drinking every day?
Enough. Um, so I would. It depends on your activity level, so it's variable. I would say until your pee is an off yellow color.
It's a good metric to use. Oh, favorite meal from the hospital cafeteria if you have one.
Ooh, yeah. So I work in Plymouth, Massachusetts, and their cafeteria has the best clam chowder in the world, hands down. Put it up anywhere. Best clam chowder.
Top 3 music albums for you.
Oh, I don't even know. I don't even think I can name a music album.
Well, how about favorite song at the moment?
Oh, my favorite song of the moment. There's a few. So, actually, NF's new album, I don't know the name of it, but NF is a Christian rapper, so his new album is fire. And I would say my favorite song on that is Happy.
All right. Controversial question.
Oh,
Pineapple on pizza, yes or no?
No way. No way.
Good.
It hurt me, so I usually get pizza for like the residents on my last day on service or for their staff, and it hurts me to buy pizza with pineapple on it, but I do it. But it hurts me to do so.
So, I have this question as any artistic hobbies you keep up with, but I think there's one side of your life that you're currently training for that definitely attributes to the 3 a.m. mornings. What do you like to do?
What do I like to do? So I usually wake up around 3:50 or 4, but I do a lot of working out and training, so that's a big part of my life. I'm currently training for an Ironman event, but also a powerlifting part of that as well. So I want to have a 1,200 powerlifting total on the morning of doing a full distance Ironman and then breaking a 10-hour Ironman. So that's one of my big hobbies. And then another one would be social media.
So, favorite movie or TV show?
Favorite movie or TV show? I would say I really like the Friday Night Lights series. That's really good. A most recent TV show, we just finished watching The Lincoln Lawyer, and I thought it was pretty good.
What's one random task you wish you could be better at?
Oh, playing the piano. That's like on my bucket list. And I want to play the piano so bad. I'm just not musically inclined at all.
Night in or go out on the town kind of person?
I think we all probably know the answer to that. But night in with my wife and kiddo.
Indoors or outdoors?
Outdoors, 1,000%.
Beach or mountains?
Mountains, for sure. If my wife watches this, she's going to slap me. Hers is the beach, hands down, but mine would be the mountains.
Would you consider yourself more of an introvert or extrovert?
Oh, I'm like as extroverted as it gets.
Was that personality trait a factor in you choosing your specialty?
1,000%.
All right, so we're getting close to the end, and this is where I include all the reflective questions for the future Med-Peds doctors out there.
Wow,
So,
all right.
you ready?
Let's do it.
So first one, what did you think you were going to be when you grew up as a kid?
A pastor.
Is there a different specialty you think you could have done?
Oh, yeah. I mean, I love all of medicine. I think I could have done majority of them. I will say, as we already talked about, my lifestyle and hurting from family time, even when I only work like 20 weeks a year right now, doing surgery would have been very difficult, but I would have enjoyed it.
If you didn't do medicine, what do you think you'd be doing right now?
I think I would be traveling the world, doing personal training on the side, doing social media, and
So everyone knows becoming a physician is very difficult, especially in America, well, just worldwide, really. Were there any times you doubted you would make it as a doctor?
Oh, yeah. Medical school was the hardest thing I've ever done in my life. So I did extremely well in high school, graduated as valedictorian. In college, I graduated with a 3.89 GPA in 3 years, did very well. In medical school, my first test, I did terrible, and it was so hard. And it took me learning how to study. But I would say those first moments, I didn't know if I was going to be capable of making it through medical school just because I knew I'd studied so hard, and yet I still didn't do good on the exam. And so that moment I definitely struggled with knowing if I could do it or not, on top of my like a lot of family issues that was going on as well that made it so hard.
So if you could change one thing about the medical field right now, what would it be?
One thing would be, oh, there's so many things. Man, that's a great question. If I could change one thing, I think it's probably because it's just so near to my life right now, but would be the, oh my gosh, this is so hard. I would say the treatment of residents through residency.
That's yes. Yes. As I
Yeah.
look very forward to starting our residency.
Yeah.
Oh, what can a medical student do right now to prepare to go into your specialty?
What can a medical student do right now?
Yep.
Again, this answer is not probably what you want to hear, and not many people would give you this advice. My advice for you would be whatever sets your heart on fire. Think about that right now. Like when you're doing this thing, it makes you so happy, and you're so passionate to do it. Whatever that thing is, and I don't care what it is. It could be painting. It could be whatever in the world it is. Do it with all your heart and find a way to make a difference in the world with it. And flood your resume with things that you're passionate about and that you love. And to me, if I see that on a resume, on top of someone who's crazy passionate about medicine, and they're doing all these other things that they love, I truly believe they're going to make a great physician because they found that balance. So that's what I'd say.
Yeah. I think that's an emphasis that is not emphasized
Ever.
ever or often.
Yeah.
So, if you were to go back, would you change any of your experiences that got you to where you are right now?
That's a tough question. No, but the one that I would consider changing is graduating undergrad a year early. So I finished undergrad in 3 years, but I had the best friends in college and loved them so much. And as you get older, you learn that there are more important things in life than becoming a doctor or being whatever your idea of successful is. And going back in time and having that last year with my best friends probably would be pretty special.
All right. Now, finally, question 73. You ready?
Wow, the last one already.
Yes.
Man.
What would you say to the aspiring Med-Peds physician right now?
I would say that medical school and residency is probably one of the hardest things that you'll ever do. And there will be many times you question not only if you're capable of being a doctor, if it's worth it to be a doctor, or why in the world did you even start this in the first place? And in those moments, what I want you to do is to reflect on those magic moments in medicine, some of which I've talked about throughout this interview, and reflect on them. And when you do, you'll realize that those moments are worth all the hours of hell that you've had to go through to get to this one moment, to get to the moments where you're at the bedside, you're serving and loving for a patient, and you make a difference in their life. But if you don't remember that, it'll be so easy to feel like it's not worth it. And so keep a journal of those moments. And when you're feeling like giving up and you feel like it's not worth it, reflect back on those moments and remember your why and the whole reason that you wanted to become a doctor. This is going to be a long-winded answer. I know you said one thing, but there's going to be a couple more. In residency, know that the computer will never fulfill. Documentation will never fulfill. All those logistical things that we have to do is not why you became a doctor. So become efficient and then spend all that rest of the time at the bedside with the patients. Lastly, do not give up the things that you love outside of medicine. That's what makes you you. That's what makes you human. That's what makes you different and unique and incredibly you. And if you give up those things, medicine will become your worst enemy. Your passion for medicine will be kept alive by your passions outside of medicine.
Could not have said it better myself. Well, Tommy, that's all I have for you. Thank you so much for your time, and of course, thank you to the city of Boston.
Yeah, Andy, anytime you're around, you're welcome, and we could go explore Boston. Thanks for having me.